So now we will discuss blowout fracture. It is the fracture orbital walls not involving orbital rim. It is the most common type of orbital fracture. Uh, in this type of fracture, the size of the blunt object will be always more than the size of orbital aperture, and the most common etiology is RTA or traffic accident, violence, and fall from some height. The most common wall of fracture will be inferior wall, and there will be the triad of diagnosis, which involves diplopia, anaphthosmos, and infraorbital anesthesia. So there will be teardrop sign on X-ray. So in management part, we can repair it by surgery. The surgery is only done if the fracture involves at least 50% of orbital floor, and it is done within 2 weeks of trauma or whatever the etiology is involved. And there can be urgent repair can be done in mostly in cases of pediatric patients, and if there is oculocardiac reflex is activated, then we can also repair it urgently. So in the same sequence, there comes another topic, which is orbital cellulitis. It is the acute infection of orbit behind the orbital septum, and there will be no involvement of globe, only soft tissue within the orbit is involved. It is the most common infection of the orbit. It occurs most commonly in the children, and most common cause will be ethmoidal sinusitis. The organisms involved in this is Staph aureus and streptococci. So there will be erythema and well demarcated lid edema extended beyond eyelid margins, and loss of vision will be there. Pain with ocular movement can be seen, and for diagnosis we do MRI or CECT. And when comes the treatment part, in case of uncomplicated cases, it can be treated with antibiotics alone. So we give IV vancomycin with monosaf, and in complicated cases we treat it surgically by draining the sinus involved